have a comprehensive set of wraparound services. So once a customer partners with Health Recovery Solutions, we will provide everything from implementation support. We'll bring policies, guidelines, training for your staff, really get you off the ground. Once we identify the patients, we will do the logistics. We handle all of the identification of the equipment, bringing it into the patient's home, setting the patient up. We'll call the patient at home. We'll walk them through their devices. We'll help them understand what exactly has just come into their house, how to use all of it. If the organization is not able to do their own clinical monitoring, we do have clinical monitoring services. And so as the vitals begin to come through, a lot of times organizations are very, and especially ambulatory care centers are very concerned about an influx of vital signs and having to track and monitor all of that. So we will provide the clinical monitoring services if that is a service that's needed. And we will triage, intervene, escalate based on a customized workflow, and basically be partners with a healthcare organization to make sure that the patient's clinical care and clinical outcomes are really aligned with expectations. We've put together what we call condition presets. So you think about a patient that has a specific disease condition, take CHF or COPD. What we've done is build ready-to-go turnkey solutions that include not only the biometrics that make sense for that patient, but also the interactive survey questions that help you understand on this particular day, is the patient's swelling a little higher than it was the day before? So a really good set of questions that the patient responds to. We also have ready-to-go educational videos that, again, align to that specific condition, so the patient is able to have simple, easy to understand videos, and then just being able to try and trend their results and see the outcomes of their performance. And so again, once the patient goes through that, at the end of the episode of care, HRS is able to provide the picking up of the equipment. We partner with UPS. We bring the equipment back into our warehouse. We have a full warehouse. We will clean, sanitize, handle all of that, take that off of the healthcare organization's back, sanitize, clean, and then send back out to the next patient, right. Which again is a lot of times the type of burdens that nobody needs to be handling if you don't need to handle that. I will add a couple more things because I think it's more than just bringing the remote patient monitoring equipment into the patient's home. It's also partnering with our organizations to help you be successful. So you think about the reimbursement needs and how you're going to bill for services for those organizations that are able to bill. So what we have as part of our wraparound support is a Vice President of Revenue Cycle Management and a team that partners with our organizations to really help them identify the appropriate CPT codes, the billing process. We have reporting. We will gather the codes for you. We will give them to you in a nice package. All you have to do is bill and get paid for your services. I think that's always welcome. We have the technical support 24/7. If a patient's equipment is broken, you don't have to deal with that. We handle that. And so really it's fully wraparound. We have clinical advisory services. My team really works to develop clinical content that is customized by organization. So again, I think as you think about remote patient monitoring, it's really more than just the devices, the scales and the blood pressure monitors. It's the how do I get my program up and running? How do I train my staff? How do I get the correct workflows up and running? How do I get my physicians on board? Is there anybody available to speak to them? What are the case studies that have shown success? We have over 40 case studies of success with our customers. We serve close to 300 customers across the country. And we've seen a lot of success. And we're very convinced that this is the way to go, and we're going to keep going in that direction.